be cure. This will be followed by a fireside chat by Dr. Asim Ijaz Khwaja, who's Director, Center for International Development at Harvard Kennedy School, Harvard University. And this in this fireside chat, he will be with Mr. Maroof A. Sayyed, President and CEO of Center for Economic Research in Pakistan, and Senior Fellow and Advisor, Harvard's Evidence for Policy Design. After this, we'll have Mr. Rana Kaisar Ishaq Saab, who is Assistant Resident Representative and Chief, Democratic Governance Unit, UNDP. On this plenary, apart from this deliberation around evidence use in policymaking, we'll also discuss about the launch of 2 reports. The first report is Citizen Perception Survey, Access and Acceptability of Public Services. And the second is Investigating the Impact on Learning Outcomes through the use of EdTech during RCT in Punjab province of Pakistan. And this is by EdTech Hub Consortium and Center for Evidence Action Research, SDPI, which actually forms the first publication of this center, which we are talking about. And then we'll conclude with the chair's remarks, followed by the dinner. So we have a very packed agenda. And I think without ado, let me request my mentor and, of course, my former boss, Dr. Ishrat Hussain, to formally open this session for us. So please.
Bismillahirrahmanirrahim. Thank you very much, Waqar and SDPI, for inviting me on this launch. This is something which I've been very much advocating for a very long time, that in Pakistan, the policies are made on the basis of some mixture of some hard data, some soft data, but mainly on partial and incomplete information, and a lot of conjectures and speculation. And therefore, we see the consequences of those policies, which are quite obvious to you over a period of time. So it is very much paramount upon research institutions like to bring into very solid evidence which will impinge upon the policymakers that will be used. And I'm very glad that Asim Khwaja, who I know for a very long time, is cooperating with this particular initiative, because they have really done a very credible work during the last several years. So I want this center to succeed for the larger sake of the quality of policy making in this country. And I hope that everyone, whosoever is in the position, should help this center in whatever way they can. That's my request, whether it is to the donors, or it is to the government, or the private sector, or the civil society organization, because the canvas has to be very, very large. It doesn't have to be very narrow canvas. So that's my hope, and I hope that Dr. Faria, who is going to lead this, would keep this in mind, that you have to be more inclusive and you have to be more broad-based rather than very narrow-minded. Otherwise, the usefulness will be very much compromised. So with these formal words, let me open up the session and let me listen, which is what I'm come here, to the panelists and to Asim and to the report launch. Thank you very much.
Thank you, Dr. Saab. And if I may add that Dr. Saab actually had to be in US. He's been a great patron of SDPI, and I'm really grateful to you, sir, that you have stayed back for this session today, sir. Thank you. So Dr. Fariha, if I can now request you for the scene setting presentation. Thank you.
Like to share the journey of SDPI in the evidence space and a bit about my journey in the capacity of lead of this Center of Evidence Action Research. So SDPI has been working for quite some time in the evidence space. We have this ACE study of SEDI supported by UK aid and titled The Role of Evidence in Policymaking in Pakistan by Dr. Bakar and his team. We have done this study for Bill and Melinda Gates Foundation for Social Protection for the financial inclusion of BIS beneficiaries. And again, a lens of evidence was used throughout this extensive field study. It's not working. It's not working, please. So we are equally proud of another initiative in the domain of evidence, that is the Food Security Portal, spearheaded by Dr. Abid Sulehi and his team, and launched by the Honorable Prime Minister himself during the times of COVID. So, but realistically speaking, we are still at a stage of infancy when we talk about navigating in the evidence space, working in the evidence space. I would really like to mention the role of the senior management of SDPI, the Executive Director SDPI, Dr. Abid Sulehi, Dr. Bakar, and the Fellow of Research Council, that when this idea of actually establishing the Center of Evidence Action Research was conceptualized, great support was extended by each and everyone in SDPI. And we are really fortunate that at SDPI, there's a very profound understanding of the critical use of evidence in policymaking and research, and the importance of integrating evidence with data. So when this idea was conceptualized, there was a lot of guidance and a lot of support that I received from the entire institution. A bit of the outputs that we have recently delivered from this newly formed center. It has been 1.5 months or so that we have been working on this center. And one output is actually to work in this domain of social protection, especially after the crisis, for shock responsive social protection, for crisis resilient social protection. And what we have done is that we have collaborated with FCDO, Subnational Governance Program of FCDO, and Oxford Policy Management for the past 2 months. And we have actually explored this area through the lens of evidence through a series of 4 sessions, including consultative session, debates, and plenary session that recently took place at the very onset of this conference. And the entire theme of this exploring social protection was from the lens of evidence, that what kind of multi-tiered social protection is needed in Pakistan, what are the evidence gaps, what kind of data registry we are supposed to have, and how we can actually make the digital footprint evidence-based for these beneficiaries. Another output which we are proud to present today to chair of the session, it's the launch of this report, is the study done that is investigating the impact on learning outcomes through the use of EdTech during COVID-19, evidence from a randomized control trial in the Punjab province of Pakistan. So this is the first publication of the center. I was fortunate to do this study with my dear friend and colleague, Dr. Rabia Nazir and Dr. Misbah Akhtar. And this study, the entire inspiration behind this study is the learning of evidence over the years, from number of programs, from number of people who I would like to mention. So we explored this gold standard of evidence, the RCT, impact evaluation. We actually launched and evaluated this intervention of teaching at right level, a phenomenal pedagogical approach that has been explored in multiple countries for learning levels. A bit about my own journey. The whole notion is to mention how inspirations matter and how they put you on a path. So it was one opportunity that was given by the faculty of Harvard Kennedy School, by Dr. Asim Ijaz Khwaja, not just to me, number of others, and I can see the trainers sitting here, my teachers, Dr. Idris Khwaja, Dr. Saud, in form of BCure training, building capacity using research evidence, a flagship program of Harvard Kennedy School. It was given to us, it came my way, and it was so inspiring that it actually put me on this journey to evidence, to have quest for evidence, to explore more. So these are just some glimpses of how the speaker journey was initiated and how it was carried along over the years in form of delivering these evidence-based modules to civil services of Pakistan. That is the whole notion of it. So since 2018 to 2021, never missed a session on this and kept on learning. And this is the repetitive learning that really mattered by the end of the day. Again, another opportunity extended by Dr. Asim in terms of actually providing an opportunity to attend Harvard Kennedy School for an evidence-based program on rethinking financial inclusion, the core area of work. And that is really what mattered. And I would really like to acknowledge, take this as a moment of gratitude. And if Dr. Asim is listening, this is the opportunity that really mattered. It changed a lot of things for me. I revisited my PhD dissertation, actually incorporated evidence into it. And then again, a lot of hand-holding and a lot of in Pakistan who actually from BCure trainer, putting me into this, exposing to this evidence-based workshop design. The first one I attended as simply as a simple student along with Naveed Aziz. We were in the same session. And then again, a lot of opportunities provided by them and actually landing in the faculty of evidence-based and delivering it to P&D of multiple provinces. And again, further this quest of learning went on and doing the whole one-year program of evidence, that is public policy and leadership credential. This is a much refined version of BCure. So the whole notion is not actually to brag about what I've done in evidence. It's all about how opportunities matter, how inspirations matter, and how it puts you on a road, and how it has happened with myself, how the institution is going to take ownership of this, and how we are showing commitment for actually incorporating evidence, something which we cannot refrain from into policy making. Thank you so much.
Thank you, Dr. Fariha. Thank you, Dr. Fariha. Appreciate this scene setting. Let me also compliment your presentation and also mention the partnership that we have enjoyed with various government institutions, without which this would not have been possible. And many of whom I in fact see today in the audience as well. And I think it's about remaining connected to them and understanding their needs at various times in the policy cycle that really helps to connect better. So I think the example which you posed, which you exhibited around the food security dashboard, was in fact a real life situation which the cabinet and Dr. Ishrat was part of that cabinet. They faced this issue in the first wave of COVID, where they wanted to track the food prices, food supplies, and demand patterns almost on a real time, trying to make sure that people really get access to food in the farthest of all the areas where probably lockdowns or supply chain disruptions may have caused issues. And I think that's probably a very appropriate example of think tank government partnership, and of course development partners also helped. The SEDI program, which you talked about, which was strengthening evidence of development impact, that was piloted in the Ministry of Commerce. And again, I think FCDU has been a long-standing partner in helping us to connect with the Commerce Ministry. And as part of this, many of the interventions were then embedded at National Tariff Commission, Pakistan Institute of Trade and Development, PITARD, which is sort of the learning arm, research and development arm of the Ministry of Commerce. And then, of course, the grievance redressal mechanisms at the Commerce Ministry were also reconfigured. They now have a very high quality chat pod where the business community can receive feedback on their complaints. I've two other examples from Planning Commission and the Global Open Data Partnership, which I'll come to later. But let me now open our panelists, Ms. Maha Rahman and Ms. Amna Akil, who are online with us. And I'll go first to Ms. Maha Rahman. Now, my question would be the same to both Maha and Amna, given the repute, the credibility of both the organizations, Mahbubul Haq Research Center and SERP. I think they have done amazing work in all these years in trying to bridge the evidence and research needs of the government. So the first question is, how has been the uptake? And second is, how can we improve it? So it's over to you, Maha.
Thank you so much. Can everyone hear me loud and clear?
Sure.
Yeah, okay. Thank you so much, Dr. Waqar. I want to first thank and congratulate your team on launching the Center for Evidence Action Research. I think it's a very important initiative, and we need many more such initiatives to actually bridge the gap between research and data and evidence and what actually gets translated into policy. Dr. Ishrat very clearly and nicely set the stage that the gaps are there and evidence is being used in a very ad hoc manner. And so how can we make that more systemic, and how can we make that more accurate, and how can we make that more useful? I remember Dr. Fariha starting her journey with BCure as a very keen learner, and first as a trainer for BCure sessions, and then she eventually also joined on as a lecturer for various trainings held by SERP. And so just to shed light on your question, I would like to share, since the theme of the conference is beyond the pandemic, leaving no one behind. And I've done a lot of work around evidence with different policymakers during COVID. And so what have I learned, and how do we take on merging evidence from where we are to where we need to be? And so I'll just share some of my key learnings during this period. So in this, one of the key strategies and hallmarks that worked really well for Pakistan is that there was a lot of emphasis on data, whether to firefight or to put some new policy in place. We may be using it incorrectly, correctly, but one thing that has clearly emerged out of the pandemic is that the policymakers' appetite to consume evidence has increased. They do demand more evidence, they want to use more evidence, and they also demand more support. To consume, generate, and use evidence has also increased. The Ministry of Health is setting up a systemic data center as once NCOC weans out and the pandemic comes to a close eventually, hopefully, the Ministry of Health now has a systemic data center. Similarly, at the administrative, provincial, and the district level, different data units have emerged with the appetite to consume evidence, generate evidence, and then deploy that in both policy and implementation. And so then therein comes the question that when that appetite is increasing, how can we support the bureaucrats and the policymakers better? And for those of us who are engaged in academia and who are engaged as researchers, I think there's some key learnings that have emerged from the pandemic. The first of all is, how do we take, what evidence do we take and how do we take it to scale? What usually works and has worked during the pandemic is that demonstrated impact, when you do quick pilots, demonstrate that impact to bureaucrats and policymakers, and make it easier for policymakers to understand and implement it. Now, the policymakers come to us with a very simple ask that don't send us papers, tell us what to do. And so I think it's up to the research academia and initiatives like Center for Evidence Action Research to make that evidence usable, consumable, and implementable. That's the first ask. The second ask is, then how do the policymakers know that what they're doing is working? So then there also needs to be instruments and data systems in place that make the progress visible and clear. And in doing all this, I think there's something that we really need to keep in mind are the political sensitivities. That how do we work within the constraints of bureaucrats and policymakers? A lot of these policymakers, I mean, they have political sensitivities of what they can do. They can share some of the evidence and report. They can put out some of it. They cannot put out. So we need to, as people who are running these centers, work within their constraints and align our incentives with their incentives. Moving forward from there, something very important to keep in mind is the implementer point of view. Whenever we are going to bureaucrats or policymakers with some research, there needs to be a willingness to adapt that design to what the implementer thinks will work well. And usually a lot of very key and interesting insights emerge when you're willing to sit at the same table with the implementers and all stakeholders and listen to what they have to say and incorporate that in your design. And think of these relationships as a long-term investment. So in light of this, I will quickly share a mask-wearing randomized control trial that was done in Lahore, both from a point of view of COVID prevention and to generate more evidence. This is joint work with Dr. Mushfiq Mubarak and Dr. Jason Evelett at Yale University. They had tested a model in Bangladesh in which they were able to increase mask wearing by up to 30% in 600 villages. We took that model, brought it to Lahore, working with the same research team, and adapted that model to an urban center like Lahore, reaching 4 to 5 million people within 8 weeks. But what that required was that we adapt the model that was implemented in rural areas to urban areas. The model had 4 components. The first was no-cost mask distribution. In Bangladesh, that was implemented by going door to door. There was an NGO that distributed masks from house to house. In Lahore, it's a big city, it's dense, we had to reach many more households. So we adapted this component to deliver masks through the postal service. So Pakistan delivering masks by mail to households in Lahore, along with the brochure in order to offer information. And then key areas were selected, in key mosques and markets were selected to reinforce this message. And since the implementing partner was the Commissioner Lahore, Commissioner Lahore and his team became models in those communities, along with different celebrities and contracts with different media agencies to actually exhibit the message, to demonstrate that this is a good practice to adopt and we should be doing more of this. So that is how we took a model that worked, brought it to Lahore, adapted it, worked with the local implementer, adapted their feedback back into the model in order to implement it. Now, how did we actually evaluate it? To evaluate it, we looked at Lahore's subdivisions. So we took for delivering masks to different households, we took the addresses from Lahore Electric Supply Company, and then we used LESCO's subdivisions as a unit in which on which we randomized based on which subdivisions would get what treatment. We listed markets and mosques in those chosen subdivisions, and quantitative data on mask wearing was collected prior to the campaign, during the campaign, and after the campaign. Qualitative data was also collected, and then this data was shared back on a weekly basis with the commissioner's office so that they could reiterate on their policy design, figure out what was working, what was not working, intervene in areas where it was not working. This is a map of all the areas in which data was collected all over Lahore. We automated data collection in markets and mosques. These are some of our data enumerators. And the data was then shared in a very implementable way at very regular intervals. That, okay, this is the total treatment effect in mosques, this is a total treatment effect in markets, and this is what we should be doing. What this entire campaign did was, we were able to configure a model that worked in urban areas that could quickly and cost effectively increase mask wearing in urban areas. But at the same time, it increased the implementers and the commissioner's appetite for consuming more evidence. And so when it came to delivering vaccines effectively, at that point, the commissioner and his team came back to us with the request that we want an efficient model to deliver vaccines all over Lahore. So can you partner with us on that? And so now this intervention is in field where the government of Punjab has set up 206 temporary vaccination centers. That has been accompanied by a social mobilization drive that we have co-designed with the commissioner's office, and that is now being implemented in various parts of Lahore, accompanied by marketing from mosques, messaging being delivered through mosques, and mobile announcements. Mobile announcements is rickshaws and trucks going with a loudspeaker in those areas, which we have identified for intervention. And for this purpose, 1,500 students were recruited from universities all over Lahore. But the idea of quickly sharing the mask wearing model and the vaccination drive is that how do we effectively create models of engagement with the policymakers, with bureaucrats and implementers, taking their point of view into account, treating their point of view with respect, adapting their design, keeping their sensitivities and constraints in mind, and then regularly sharing feedback and data with the team in a consumable way. I think that is a very effective model that can be replicated by various data centers and by various research centers if we actually want to incorporate evidence into policy. So I think I'll stop here. I had 7 minutes, and I'm happy to take comments and questions.
Really appreciate your inputs here. Fascinating example, demonstration effect, which was at over here. But I think one's faith is also revived when you see that there was an equal sort of uptake, traction by the civil service in place, and I think the support which Commissioner Lahore's office was providing to this subject and the attention which was being provided by his office. So I think one of the ideas here is to really find such champions of change within the system. So thank you, Maha. And it's over to Ms. Amna Akil.
Yeah.
Thank you so very much, Dr. Waqar and Dr. Farina, for inviting me over to the launch of Center of Evidence Action Research. I think it's absolutely wonderful to have more of these initiatives, because I feel, having been associated with the public sector for a few years, I feel that, you know, in these current times, there is no doubt that the realization by the government for having data and evidence being embedded in the policy making process, starting from the planning phase to the implementation phase, is more than ever. I remember back in 2019, we had a workshop with Ishrat Saab, and we were constantly talking about capacity building and, you know, getting people engaged in the system, because I think for over the past 10 years that SERP has been associated with the government sector. It is us reaching out to people to get trained and, you know, to get them sensitized, you know, with data and evidence. But just a very small example, I think the current change that we are seeing in the overall scenario, only for the year 21-22, the government initiative of restructuring and strengthening M&E units of $1 billion. right now, it's not a matter of how big or small the budget is, but the idea that the focus on monitoring and evaluation of programs entails and ensures that we need more reliable and accurate data, right, for the use of evidence-based planning and evaluation of national and provincial level policy programs. But however, being said that, just willingness and setting up of these units is not enough. It doesn't serve the purpose. I mean, whenever we go to these institutions and we talk to people, what we see is that the willingness is there, but the capacity to actually implement, or sometimes, there are constraints of funding that is there. And I think that is where institutions like SERP and SPDI and other think tanks come into place, because the demand is so huge, the need is so huge that, 1 or 2 or even 10 centers alone can't fix the problem. And I think for that a purpose, over the last 10 years, we have been really, at the center of providing trainings to policymakers. And this year we have crossed the mark of over 5,000 policymakers and policy actors. And it gives me great pride to say that, the demand now is moving away from individual capacity building to institutional level capacity building. And that just shows that the need is there, the willingness is there, the demand is there, and they're asking for it. And as Maha mentioned, I think the problem which arises is that building those capacities again becomes a constraint when they are not able to implement it. And that again, creates that a dead stop of what to do with this knowledge. But having said that, with more of donor funding coming to Pakistan, with more and more of development programs being made, we need to ensure that the right evidence is provided, and we are there as these centers to give that evidence and data, whether qualitative or quantitative, to support our governments in making the right policies for more impactful and sustainable programs. And having said that, we need to develop capacities, internal capacities, to be able to do a bit of hand-holding where required, for them to be able to implement the knowledge that we impart to them. And with that, once again, I would really like to congratulate you, and I'm really happy to be here in the presence of such auspicious speakers. So over to you, Dr. Faria and Dr. Waqar. Thank you so very much.
Thank you indeed, Amna, and of course, SERP has been a partner in this journey, and we really value this partnership and look forward to continuing this collaboration in the coming days. I think you rightly pointed out, and this really needs to be highlighted, that no single think tank has the capacity to really take this forward on their own. And this is why I think think tanks within the government also have to assume that evidence leadership role, where, for example, if I can say, there are government planning commission, PITAD connected to Commerce Ministry, E&D department. I think it's these relationships which have really worked out well in COVID times, and these think tanks have provided advice really in a very urgent manner, in a very rapid manner to the government when it was required the most. One of the things that I think which I can build upon your argument is that whenever, of course, a government requires transdisciplinary advice, that is the second area where, for example, think tanks need to build capacity. And in one of our programs, subnational governance, supported by FCDO, one of the things that we found out was that in the recurrent waves of COVID, governments' own capacity to procure rapid research, local rapid research, was constrained. And it's not about the budget line, that they didn't have the budget line to hire, for example, local consultants. It's about the systems which were so complex. It's about the procurement systems which were so complex, due to which rapid local advice couldn't be hired. Now, if you're in the federal capital or in the provincial capital, you would end up requesting the development partners to do that. But if, for example, I go back to the earlier presentation, what if Commissioner Kohat requires advice from the University of Kohat? Can Commissioner Kohat procure that rapid advice very quickly? And that's where I think one would need to sit with government partners and really easing those procurement systems wherein evidence can be procured going forward. I now see that we have our guest of honor, Dr. Asim Ijaz Khwaja, online. As I mentioned in the beginning, Dr. Saab is the Director, Center for International Development, Professor of International Finance and Development, Harvard Kennedy School, Harvard University. I'm really grateful to him that he's made it at some very harsh time zones, I must say. It is very early for him. I am equally grateful to Mr. Maroof A. Sayyid Saab, who's President and CEO of SERP and Senior Fellow and Advisor, Harvard's Evidence for Policy Design. We have had a recent opportunity to collaborate with Maroof Saab, for which I'm very grateful. So for the next some time, I am going to now request both of them to indulge in some very interesting fireside chat for those who are available here in person and those who have joined us online. So it will be Maroof Saab in conversation with Asim Saab. Over to you, Maroof Saab.
Thank you, Waqar Saab. This is wonderful. Hopefully you guys can hear me clearly. I see a lot of familiar faces, Ishrat Saab and Naveed and Faria and many others. And a very good selection of panelists, I must say. A lot of familiar faces there as well. We talked about evidence, and you guys probably heard. I guess is there an echo that you're hearing?
No, you're perfectly fine.
Okay, great. All right. What we wanted to do was change the pace a little bit. Keynote addresses are great, but I think we needed for this fireside chat maybe a virtual flyer or two. But the thing is that we sort of begin with our personal journeys, or Asim's for that matter. So let me turn it to Asim and ask him that we obviously know Asim. You grew up in Lahore, partly in Lahore and many other places, but went to school in Lahore and then went for undergrad, outside US and grad school. And we have sort of followed your journey in terms of, really reaching the heights of research and really involved in a lot of evidence gathering and policy influence in Pakistan. So I wanted to sort of get a more personal journey out of you, your journey to the US, but also back to Pakistan and really getting involved in research and policy making.
Wow, Maroof, that's a tall order, but I'll try my best. First of all, assalamu alaikum to everyone. It's a pleasure to be here. Thank you for inviting me. I see very familiar faces. Dr. Ishrat Saab is in the audience, so I'm hesitant to give my personal journey, but one big motivation to give it is that he was very much an influential part of my personal journey. So as I talk, I'll mention that as well. But assalamu alaikum everyone, Ishrat Saab in particular, and Waqar Saab, thank you so much. I guess if I think of my own kind of journey into evidence, I very much was educated in the standard educational system that someone from an urban area in Pakistan would be exposed to. I don't think it was very research conducive, honestly. I think we don't necessarily reward curiosity. Whether it be the current educational system we have, or even almost 3 decades ago when I was kind of in high school. And so I don't think my journey started with the desire for evidence. I think my journey started very much, I'll be very honest, and my journey very much started with just do well and get into a decent place. I don't think I was quite aware of what research meant. I hadn't been exposed to it. I was much more exposed to do your best when you answer a very well specified question. And that's very different from research, right? I realize now, as I've taught over the past few decades, the hardest question you can ever ask any student is design your own question, which tests the material that you were taught in the best possible way and answer it. In fact, you don't even need the student to answer the question then. If you're able to design that kind of question, you already have shown mastery over the material. And that's not what I started off with. And I remember the first time I went to undergrad at MIT, I was lucky to get in. It was a great place. And I remember the kind of shock I got when I first joined, realizing that I was unprepared for the kind of education I faced. I knew how to solve complicated math equations, but I couldn't think through a problem that I hadn't encountered before. I just couldn't. I hadn't been trained that way. And the reason I bring that in is, for me, what generates the demand for evidence at a very base level is the fact that you realize you don't know what's going on, right? If you think you know what's going on, you don't really need evidence, right? You know what's going on. You just execute. Maybe you need evidence to see if your execution is working well, but even that. So I think at some very base level, the demand for evidence comes from, funnily enough, an insecurity about your own knowledge. Right? And insecurity about whether you can achieve whatever goals you're trying to achieve. And I think sadly what happens often with experience and age is that insecurity diminishes. Like the people who have the highest demand for evidence are toddlers, or children, because they're constantly exploring, they're constantly absorbing. As we get older, I think, and this is the curse of knowledge, as we get older, I think we start thinking we don't need to. And that's something which I first realized at the age of 18 or 20. I honestly didn't realize it before. I actually was doing very well in high school, so I kind of thought I knew it all. Even at that early age, I apologize for that sort of young arrogance. And I think being exposed to an environment where you were posed with questions, I actually still remember this. I was taking a hard math class somewhere in my second year or something. And this professor used to pose questions, which we didn't realize afterwards were actually unsolved questions. I mean, literally, like unsolved math questions. And so you'd have this problem set and you'd struggle with it for hours and hours, and you kept on saying, I must be really stupid because I can't do this. I just can't solve it. And it turns out that every once in a while, this professor would put a question that, because it was an unsolved problem. And imagine the kind of audacity to take a 19 or 20-year-old and think that they're capable of solving an unsolved problem. I think it's audacious. I think it's crazy at some level. But it was also amazingly uplifting at some that you could actually do that, and some people did, right? Since then, kind of, I would say from that point onwards, for me, suddenly the world changed a fair bit. I started sort of maybe coming to terms with my toddler side. And realizing that a lot of the problems that we faced, I was very committed to Pakistan. I still am. I sit over here, but as you all know, I come very often. All my research is in Pakistan. Fast forward my PhD. I finished my PhD with another really close friend of mine, who several of you know, Atif Mia, who's done phenomenal. We were hungry for evidence. I had, in my dissertation, I had gone searching for evidence in the northern areas of Pakistan. And I'm very grateful also to AKRSP at that time, and even now, and NRSP, the whole RSP family. I know Bajwa Saab and others were on previous panels of yours. But that whole, and I know Shoaib Saab was, I think, also on a panel. So that whole RSP movement to me was, for someone who was sitting at Harvard doing a PhD, studying, going to seminars and studying all these things, The only reason I ended up in Baltistan for a year, which I did while I was in my third or fourth year as a PhD student, it was this curiosity. I felt like I could sit in Harvard and I could do some paper on an equilibrium refinement and some game refinement. But that didn't pique my curiosity. That didn't, in the way that sitting in, Skardu, over the winter did. Because what you saw there, and this is what I mean by the thirst for evidence, what you saw there was really constant data coming in, constant questions coming in, constant puzzles coming in. Why is this not happening? Why do we see so much? I'm gonna give you trivial examples, but I'm just giving an example of kind of how this deep burning desire for curiosity gets gradually, it wasn't inherent, it gets built. Well, it is inherent. As a child, you lose it over the years of education, and then I think you try and have to reclaim it back. But I would look around, and for those of you who have been to these parts of Pakistan, if you go in apricot season, the one thing you see is thousands of apricots on the grounds, and that seems insane. Like, this is a really tasty fruit. It's expensive in Lahore or Karachi or Islamabad. How can you be throwing it on the ground? That makes no sense. And in fact, it shouldn't make any sense because it's a complete waste of a resource. And it turns out, not surprisingly, you start asking questions, you start gathering data, what is happening? And you go to very basic economics like supply and demand. There's a moment where there's excess supply. There's too much production. You can't possibly eat apricots all the time. The demand isn't large enough. When you say, well, why is there excess supply? Why aren't we able to move this apricot production downstream to Karachi and Islamabad and Quetta and wherever else we could take it? Well, you start thinking about production things. You want to get data on what is the production process of a failing. Are transport costs too high? Well, actually they are, because we're in this remote area, transport costs are really high. It probably isn't feasible to do this. No one wants to buy apricots at that expensive markup that you would need. And you start asking other questions. Say, okay, well, that's the case. Why isn't expect a lot of money for like dried apricots? Well, it turns out it is. AKRSP is trying to do this preservation of apricots. So you start asking and each of these questions, each of this curiosity, you realize can only be answered if you gather data, because you don't know. You can tell 50 stories. So it starts with these alternative storytellings about the world around you, and then it drives the impulse of asking questions. And I would say my journey, Maruf, has very much been over and over again, rediscovering that child in me, rediscovering why is this happening? Why is this not happening? Why do you see beggars in Lahore in a certain way? Why do you see on one street corner, a certain type of begging, and another street corner a different type of begging? It can't be random. There must be something going on over here. Why do you see street children picking garbage in one place and not in another place? I'm just giving trivial examples. I'm not giving examples of big growth questions. I'm happy to do that as well. Why are exporters not exporting? Why is Pakistan's export to GDP ratio been flat for the last several decades? Despite the fact that you see great buoyancy, great talent, what's going on, right? So each of these questions to me begs the data question then. And, my journey very much has been now just that. Right? I look around. It's a very fun world in that sense. Look, the best thing you can give doctors is lots of patients and lots of diseases. Doctors love it at some level. It forces them to think about things. It forces them to come up with new treatments. You get that satisfaction of having cured someone. I look around countries like Pakistan and I see lots of puzzles like that. Lots of, I don't want to call them diseases because it sounds very negative, but just lots of puzzles, lots of things that should happen are not happening. And the minute I think about those things, the next question comes to me is, well, let's get data, let's figure it out. And I don't want to dismiss, often when we think of data or evidence, I think we tend to dismiss qualitative stuff, especially the quant people. We tend to say it should all be large and objective surveys. I'm a big believer, look, don't get me wrong, I am a large and big data person. And nowadays, in today's world, that big data term has become far more meaningful than it was before. Like a survey of 10,000 people used to be big data. It's no longer billions of observations. Maruf, you know this from your previous world, the kind of private sector world, right? But I want to emphasize that this aspect of this drive from data won't start with that kind of quantitative data. It'll actually start with stories again, because we as humans can't process large data, right? I give you 10, I mean, you could do this test for yourself. We've done surveys. If I ask you to rank order 3 things, it's easy, you can do it. If I ask you to rank order 10 things, it's really difficult to do, because we in our mind can't process that much data, which is why we need econometrics or machine learning or tools. But what we can process is stories, which are, I would call them anecdotes, which are powerful first steps in your desire for evidence, right? And so the anecdote is, again, coming back to my example, let's say I'm trying to figure out why apricot exporting isn't working in Skardu. I wouldn't start with a massive survey. My first data collection will start with just a bunch of conversations with people who are in this business. What's going on? Why do you're the guy who has these apricot orchard. Why is it on the ground? Why aren't you doing something about it? And the other thing I've realized is never assume the other person is not smart. Everyone's smart, right? If the apricot is lying on the ground, it can't be that you're the genius who've seen the apricot and they haven't. Of course they're seeing it. They're seeing it every day. They must be thinking about it. So give people the benefit of the doubt that the problem they must be facing must be a deeper problem. So keep asking, right? You may get the first response to be like, yeah, well, whatever. There's a lot of production. We can't do much with it. And then you push and say, well, why can't you do much? For data, to me, starts with curiosity, then moves to anecdotes. But this is critical. You don't stop at anecdotes. The one thing I see in Pakistan is sometimes we are missing, and Pakistan is no exception to this. I think when you get in life, you just get busy with work, you stop, that curiosity starts dying down. So I think the first thing is to stoke that curiosity again. And then move to the anecdote version of the data, but then realize that's not sufficient. That's not generalizable. That may be your personal experience. Like, I can't tell you how many conversations I've had with senior decision makers, and I, with all respect to those conversations, it does start with, I grew up in community X or village X, and in my area this happened. That's a great place to start. But often we just stop there. And that's a very dangerous place to stop, because then you're generalizing from your personal anecdote to the rest of the world. And the one thing I've learned about the rest of the world is it's very different. There's a lot of heterogeneity, which is beautiful about the world, but it also means that you now need to start moving towards a larger. So that's going to be in my journey. Sorry, it was a long-winded answer, Maruf, but I wanted to at least show you how I started. And now where I am is in this kind of keep asking questions, start with the anecdote data, and then move to the evidence data. But it has to start with that deep hunger. If we don't feel that deep hunger, no matter what we do, no matter how many courses we run, Maha, no matter how many people you have in your center, and Dr. Saab, you're familiar with this, no matter how many kind of researchers you invite, it's just nothing's going to happen. The data is just going to sit there. Even if we have the data, no one's going to use it. No one's going to care about it. And so, and I should end by again acknowledging, I know I do this, Dr. Saab, I embarrass you every single time, but I just feel I have to do this. When I first started my research, I was bubbling with curiosity with Atif, and I got connected to a data fire hose thanks to Dr. Saab, who for some reason, the scary thing is when you have curious people interfacing with you, sometimes it's scary because they ask things which perhaps you don't want to ask, right? But I think, Dr. Saab, you were very generous in opening that doorway when you were the governor of the state bank to us. And that just fed our curiosity even more. So I'm always eternally grateful to that, as I am to my AKRSP colleagues who fed my curiosity at that time as well. So I'll just stop. Actually, let me turn it back to you at Samna and Maruf. I know this is meant to be a conversation, but you came to your data journey in a very different way, right? You came to your data journey from someone who's been in the corporate sector in the US, isn't in policy, and comes into policy, and now is leading a policy institute in Pakistan. So I don't know what your journey has been.
Yeah, no, I think this was really, I think, hopefully enlightening for the attendees as well, because a lot of times we read papers and research papers, but there is a person behind it. And I think I wanted to bring that out. And I think I'm really grateful that you shared your sort of personal journey. For me, I mean, like you said, and I'll keep it short, but basically I grew up in a similar sort of, mega urban city like Karachi. And I'm still asked why I'm back in Lahore, which is a different conversation we can have. But, for me, similar journey, engineering and economics, but I often say that in South Asia, people do engineering and then they figure out what they want to do with their lives. It just took me 20 years to figure that out and bring that. I think it really was a good timing as well. But, I think what you said is, I think, what gnawed at me as well, which is that, a lot of times technology also became very solution centric when we actually didn't really pause and understand the problems, right? And I think that's where evidence really comes through. It's not enough to just say, to your point, some anecdotal data and, it explains the world. Well, it doesn't actually. And a lot of times the curiosity and the humility you get is by talking to, for lack of a better word, ordinary citizens. Go out in the field and, chatai pe baith ke baat kare. And you learn a lot. And those are the first set of questions that then you need to dig deeper and, to your point, sort of understand that causal inference, right? So for me, it was really, a lot of it was about the same curiosity. Why things are happening the way they are. It's not enough to just explain it in some, one experience, but to have that humility that you don't know the answer and you need to understand it better. So I think what you said earlier about being a child, I think it's a very interesting point, right? Because there's one thing that children are naturally sort of learning oriented. And they ask a bunch of questions. I remember my kids asking why, and it's it's a series of why and never ends. And on the other end, it's the look, as we acquire knowledge, somehow we lose that humility. Now, if we sort of expand that, and here, there's a great conference SDPI has put together. There's a lot of great panelists. And a lot of really interesting conversations. A lot of times when we're talking about evidence in policy making, we want that curiosity and that learning and that humility to somehow stay there. And, even at a very state level, let's talk about, create an environment where that curiosity comes through. And partly it's also, how can we lower this expectation that you're never going to have perfect design right from the beginning, right? So if you can talk about, in your experience working, especially in education, obviously both at the provincial level, at the federal level, how to approach that, how to capture that curiosity and retain that learning ethos.
Thanks, Maruf. That's a tough question, and if I may, I might, once I've given my response, maybe turn back to Ishrat Saab and Waqar Saab, and maybe they can also respond to that, having seen that for a lot longer than I have. The challenge to me is I think you nailed it when you said, look, there is a sense of, creating learning organizations, right? I think curiosity is amazing. When you audience, with a child, curiosity feels becoming. Of course, you are going to be curious because you don't know stuff. When an adult shows curiosity, there's an opposite and negative side to that coin, which is what you don't know. And you don't know part loses confidence in people. And so this is a challenge. Like, kids are not running the household, right? And so kids have the space to be curious because no one gives them that responsibility to be the knowledgeable leader. For leaders to be curious is a very dangerous, somehow, almost feels like a dichotomy. It almost seems like a contradiction, You know, you, the leader, should be the one who's going to take us safely wherever we want to go. Right? God forbid Quaid-e-Azam or Iqbal didn't know what Pakistan was meant to be. Of course they did, right? For us to say, I don't want to get controversial, but for us to say maybe Quaid-e-Azam didn't quite know what he was doing. Maybe Iqbal's vision of Pakistan wasn't quite fully worked out as we thought. It's very difficult for us to embrace that, right? It's very difficult for us to say that these people who we fully believe and rely on and trust don't fully know what they're doing. And now imagine taking that to any head of an organization, any minister, any secretary, any CEO, right? So, and I'm not naive enough to think that you don't need that. Of course you do. You need people to believe in you, right? And I also think, sadly, fundamentally, the way human minds think, we need confidence does not come by saying, I can figure it out. Ideally, that's the confidence I would like. I would like to have a leader who I trust, not because they know everything, but because I know they can figure it out. Startup, and the worst thing you can do is to say, I don't know what's going on, but I'll figure it out. You sell the thing. You say, I've succeeded already. Like, I'm already there. You just have to come to see where I am at. You just have to realize that I've achieved success. It's just a matter of time. Inside, you know you're not there, right? Inside, you know, but my hope is that you know you can get there. You have that confidence, you have that ability. And so I think there is a big difference between how I don't mean to say we should be obfuscating what's going on, but I think there is a need in the political economy of decision making to both exude confidence. We know from, look, and I'll put you on the spot, Ishrab, as a central bank governor, I'm sure, Ishrab, you knew there were times when things were really not looking good. But for you to come out and say the economy is tanking would be self-fulfilling expectations. You would tank the economy if you said that, right? So there was a sense in which I assume, and sorry, I'm putting you, Dr. Saab, on the spot, but I assume, and I'm sure Raza is doing something similar these days, is a sense of confidence, authority, we got this, we know what we're doing. But at the same time, internally, the organization was rapidly learning. And to me, that's the mix we have to do, right? The mix we have to do is we have to display this outside confidence, but we can't drink our own Kool-Aid. You can't internally believe that confidence, because if you do, you're going to make a mistake, right? Very delicate balance between when can you do that and when can you not. And the successes I've seen is when we're able, first of all, I think on the margin, most people in that balance are on the side of overconfidence. We know it and not learning. But I'm not advocating for a world where we say, we don't know anything, who knows? I'm not saying a politician should get up on a stand and say, I don't know what's going on, but I'm going to figure it out. I don't think that politician will get elected. I think the politician should get up and say, I know what's going on, we're going to do it, I will solve your problems. I don't think you need to lie. I think you need to talk more and more about the thing that you want to achieve. Social protection will happen, you will have food on the table, you will have meaningful employment on the table. I will make sure this is happening, don't worry. Don't get too much into the processes of how you're doing. Don't force yourself to be a single solution to that, right? Allow yourself the freedom to explore the solutions while you commit in great confidence with the outcome you want to achieve. I would argue, and this is where I would disagree on education policy in Pakistan, what's currently happening as well. I don't want to again get into that debate. But I think we should really be very unified, multiple ways of achieving those objectives, which allow for this kind of curiosity and exploration to happen. But perhaps, Maruf, if you allow, I don't know if the panelists, Dr. Saab and both Dr. Ishad and Dr. Waqar, and obviously the other panelists, Ria and others, if you want to comment on that. Dr. Saab, you have a lot of experience in this. You've navigated this question, so I don't know if you wanted to add something to it. I'd love to hear from you.
Asim, I'm here to listen to you, because every time you speak, I enjoy your conversation. So I'm not going to take away your time.
That's very generous.
Dr. Aston, and maybe just fulfilling my responsibility as a timekeeper, maybe if you can continue for another 5 minutes, because then we have the other two panelists who we'll bring to the discussion. So the next 5 minutes are yours, please.
Great.
I think perspective as well. So we'll have to carve out some time at some point to do that. But so in the 5 minutes, Asim, I think for me, it was really important. I mean, it was a pretty costly decision for me after 26 years in the US to come back to Pakistan. And one thing about what prompted that was, of course, SERP's excellent research platform, but really the commitment to build institutions in Pakistan. And, Dr. Waqar also talked about this and other panelists, where we need not just, one or two institutions, we need several institutions to work together. We often say that, government should do data sharing and data, availability with outside government actors or institutions, but there's a lot of opportunity to do data sharing across institutions as well. There's great work happening at SDPI, ideas, by several other institutions. So this concept of institution building as a vehicle to produce quality evidence and embed it in our decision making, if you can reflect on that, I think would be the last question I'll ask you.
Yeah, that's a great question. Thank you, Maruf. Again, a big question, but let me respond to it in the next few minutes. Let me give an analogy here. Data to me is one of those few things that the more you use it, the better it gets, right? Just think about it for a second. Most goods that we are familiar with, most goods and services in the world are exhaustible and excludable. The more you use them, the less you have of them, right? Data is very unusual. And the reason I mention it that way is because if you imagine you had a good where if you were allowed to take a bite of the apple, we're not used to thinking like that because all the goods we know are not like that. When Maruf takes the bite from the apple, I have less of an apple to eat. And so my tendency is to not even show you the apple, let alone let you take a bite. Like I'll say the apple doesn't even exist, Maruf. What apple? Apples? I don't have apples. Do you have apples? And I think what we need to realize deep down is just like if you lived in a world that your apple bite and my apple bite produced more apples, we need to realize that we're not in a zero-sum world in the world of evidence and policy making. Even if the world presents it like that, there's a donor grant, we're all applying for it. There's a government project, we're all applying for it. I'm not saying we do that all the time, but often there is a competitive sense to it. But I actually think of evidence very much, or institution building in Pakistan, very much like that apple, which keeps increasing the more you eat it, right? But the challenge is we all got to take a bite in it, and we all have to help each other. So when I find the apple, my first instinct should be to say, guys, I have an apple, come, right? It's that special kind of apple, right? And so can we deeply agree? Because you could talk about institution building all the time, but at a deeper level, do we think of institutional building as what in economics we would say a positive sum game or a zero-sum game? And I think for a lot of us in the world, we think of this as a zero-sum game, my institution versus your institution. I'm not saying that for anyone on this table. I mean, but that's the first gut reaction you have. And I think we need to realize that in this case, it isn't that way, right? Our game is to get people in Pakistan, our policymakers, our public, our politicians to realize how amazing this world could be if more and more institutions like these could co-create with each other, could co-share with each other, could open up with each other. The ability for a government organization, no government organization will have the talent or the skill set or the time to do the kind of work that we're saying. It's just not possible. It's too much. You can't afford it. The public, but you have to create these collaborations, right? You have to build academies, the research institutions, universities. It's within universities. We don't run an effective seminar series across universities in Pakistan. I find that insane. Maybe in some sectors there is. I know Nadeem was at some stage Nadeem Haq was trying to do it, but my bread and butter is I present my work across all of the US universities. That's understood, right? So I think we do need to have this narrative of positive sum and then use that to really realize that it's in my institution's self-interest to interface with you. And when I have an interface, when I have a project with the government, get other people on board, right? So let me just stop there. That's at least the way I think about the world. But you know, I hope we can all kind of achieve that exciting thing, because then in 15, 20 years in Pakistan, we'll just such an amazing amount of knowledge about everything possible. And that's an exciting world to be in.
Thanks, Asim. Not one apple, but two apples, right? Now you've made everybody hungry. But, you know, thank you for your time. Thank you, all the attendees. I think this has been really great. And hopefully you can connect the person to the evidence as well. Thanks, Wakar.
Thank you, Maruf Saab, and thank you, Dr. Asim, for really taking out time. And I'm glad that we did this. As a student of economics, student of policy, I just wish this conversation had not ended. And unfortunately, I have to end it as the timekeeper. So I'm really sorry about this. Please, sir.
I just want to say that my only quality is that I can detect talent. And when I spoke to Asim and Atif, and they were graduate students looking for data, I could predict with great degree of giants in the fields. And today I'm very proud that my prediction has proved right. So that's my way of paying tribute to Asim.
Doctor. Let me now move on to our next set of panelists. And I think before I go to them, they have been collaborating on a very interesting task, which is around citizen perception survey, access and acceptability of public services. Again, something which is very evidence data heavy. And just to give a formal introduction of this, the UNDP, in collaboration with FCDO, commissioned a multiple wave survey aimed at gauging citizen satisfaction with key public services. The survey was meant to establish a baseline of citizens' opinion and satisfaction levels regarding key public services across Punjab and Khyber Pakhtunkhwa provinces. The survey covered over 27,000 households and is representative at district level. Citizen Perception Index, the main indicator used in the survey, has been presented. There are some very interesting findings which are part of today's launch, and the team which conducted this is also here in case people would like to engage with them. And the findings, of course, indicate how contributory factors, health and education services, we have gender differences which have had their impact on active citizen engagement. Gender remained a key variable when it came to awareness level, determining awareness level at community level as well. So on this, I think the two organizations who collaborated, UNDP and FCDO, they are represented now here on our panel, and I'm very honored to have Mr. Naveed Aziz and Mr. Rana Kaisar Ishaq with us, representing FCDO and UNDP respectively. Of course, given that the report launches here as well, I would like them to touch upon this report a bit if they would like to. But one of the questions which I really wanted to ask them, if they can touch upon that, was that they have the funders' perspective as well. They have been on the other side of the table who actually fund the generation and use of evidence, and really wanted to have their views from that lens. So maybe first, if I can request Mr. Naveed Aziz Saab. Over to you, sir.
Thank you, Dr. Wakar. First, let me thank you and SDPI, and of course our partner organization UNDP for organizing this session. I'm really humbled to be in the company of giants like Dr. Ishar Hussain, and the very inspiring discussion that we heard online. So I'm really nervous that I'm not going to be able to contribute much. So I think this will be a very rapid shift from sublime to ridiculous, and I apologize for that. And the other thing is, you've already, I think, stolen or read off from my notes, so I do not have much to offer. This will be just a random set of reflections that I'm going to share. So again, my apologies if I sound very incoherent or inconsistent. I think from our perspective, I'm here on behalf of what used to be called DFID, UK Aid, and now it's called Foreign Commonwealth and Development Office. But I would not be representing organizational views here and to the cause. So I'll start off by saying that I think a lot of people often use data and evidence interchangeably, which is fine. But strictly speaking, they're two different things. Data is just a set of information, could be numbers, could be percentages, whereas evidence is its analysis, its use, using information or data to come to a conclusion, so that can support decision making. So this is again a commonly held belief or perception, especially on our side of the house, that government does not use data that much or that effectively or as intelligently as it should. I would like to present a contrarian view to that. I think all government departments generate huge amounts of data, oftentimes too much for them to handle. But where they lack perhaps, or where there are shortcomings, I would not say lack, is how do you package that data and that information so that it can be used intelligently and effectively for not only policy making, again, another fascination that we have as development partners with this process, policy making. The story does not end there. The story actually begins from there. And more importantly, how do you use information as well as evidence in policy execution? So this is something that I think we as an organization have been trying to put a lot of emphasis on, that our support should focus that value. We don't want to replicate what government is doing. So I think a shift has been happening slowly but gradually away from setting up another MIS system, for instance, right, or another data gathering system with this misperceived notion that government lacks data collection mechanisms. I think the mechanisms are there. Of course, they can be improved. But as I mentioned earlier, the important thing is how is that data used. So we did carry out a study sometime back in health department in Punjab, and we found out that there are already 13 different MISs operating. And not surprisingly, they were not talking to each other. Perhaps they still do not talk to each other. Crisis like COVID is a unique opportunity where these things have come into sharp relief. But my fear is once this subsides, we'll go back to a suboptimal situation of what we call normalcy. So I think we are not really good at learning from crises, although crisis is a very golden opportunity to learn and improve. So that's one shift, I think, which I've seen happening on the development partner side, especially FCDO, that supporting creating yet another system of data collection system, and you've been part of some of those initiatives. What is important is how is that data used, and here I think again, if you look at and I see, I think at least few civil servants in the room, everyone is familiar with PC1, and there's a template of that. Perhaps goes back to the days when DOCSA was in service. But that is not necessarily a bad thing. Things should be cherished. But again, the process is not followed as it should. And rather than introducing yet another reform or yet another attempt at reforming the whole planning cycle, some things which are really small can be done, which is sometimes just simple, plain adherence to what the book says. So even that is missing in so many cases. So rather than going for big bang reforms, I think reforms on the margins are perhaps more useful and perhaps easy to very slowly expand. I would not say exponentially, but very slowly. Even that we should count as success. And the other thing is monitoring and evaluation. There are so many cells in planning departments and other departments also, and we have shifted from M&E to MEL, monitoring, evaluation, and learning. At least in the West as well as in the development sector, at least we claim to. But I think government is still fixated on the servant, whatever level they're operating. Would they really like to monitor things, right? Because that's mostly used as a tool for controlling people, controlling resources. Not enough attention is paid on E, and I rarely have seen any effort at going to L, which is learning part, right? So this is the I think emphasis that we are trying to now put in our programs, that governments with our support should be able to move from monitoring to evaluation and ultimately to learning. Some of the work that we started with Dr. Ishrat Hussain Saab when he was in the Prime Minister's office is the performance agreements, which we're supporting again through UNDP in collaboration with UNDP, where now, sir, a lot of emphasis is on evaluating also the various interventions which were initiated under your able guidance. So rather than collecting data from ministries and monitoring them and then adding yet another layer of accountability, the emphasis should be on mutual learning and evaluation. So that is the another shift I think that's happening in our programs, and we like to collaborate with governments, provincial as well as federal, on that. And I think the third thing is making that data and evidence public. Our equivalent of a PC1 is called business case in DFID, and some of you might be familiar with that. In the World Bank, they call them PADs, or project appraisal documents. So any intervention that starts has to have these two documents, and UNDP, I'm pretty sure, also has templates. And if you Google them, search for them, look at them, they're really some of them are as good as a research paper of international standing, right? So much effort goes into preparing those plans. A lot of evidence is used. Government ideally should also do that, but I think where we are now trying to have a conversation with government, make them public. So all of our business cases are public documents. All of World Bank's project appraisal documents are public documents. PC1s are for the citizens of this country. Ultimately, all development interventions are for improving one service or another, right? So citizens should have the right to know what is government doing and how are they doing it. I think if you shine that light on some of the processes, things would automatically improve. I don't know how many have you actually seen a PC1. You would rarely find them online, hardly any. So you really don't know what is government trying to do with taxpayers' money and what is the developmental objectives. Here in this country, fortunately or unfortunately, is fixated on processes and inputs, right? So whenever you go to very high-level meetings, most of the discussion remains at the input level, right? But if you look at the template, the government's own templates, they do talk about outputs, outcomes, impacts, but no one really does that. So if you make those documents public, at least there will be some pressure on government to do those things right? So again, this transparency agenda is another thing that we are quite keen on, and also are trying to work with governments. We are partners of planning and development departments in KP and Punjab through the subnational governance program that you mentioned. There are other programs also. So this is again a reform that we are trying to nudge government to move towards. So I think these three shifts are happening when it comes to use of data and evidence. And in terms of, so I think I've taken up a lot of my time, but if there are any questions, I'm happy to answer. And if given another opportunity, I can talk about some of the future interventions that we have. Thank you.
Thank you. And without ado, I'll now invite Mr. Rana Kaisar Ishaq for his interventions.
So thank you very much, Dr. Vakar, and Dr. Sir, with your permission, sir. So being humble and feeling very honored to share the table with you, not over the colleagues you have here on the left side of you. I'm talking about myself. So, Doctor, basically you stole most of my points, and then Naveed has totally diverted the conversation to another angle. So I will also keep aside my talking points, which were basically to present the findings of the survey. I think we have the report, and then Bilal Sahab is sitting here. Minhaj Sahab I also saw. They were heavily involved with data analysis and this whole process of citizen perception survey. And of course, SDPI were our partners. This report, this survey exercise, the 3 waves of this commissioned by FCDO to inform their SNG, subnational governance interventions. I'll just touch upon a couple of points which Naveed also mentioned. I totally agree that we happen to be planning for our UN's next 5 years programming cycle. So we have been doing consultations across the board with federal government, provincial governments, development partners as well. So I think what is coming out clearly, the message is that execution or implementation is the real challenge. We have plans, we have 2 planning processes, we have planning tools like Naveed talked about PC1s and other things. So the challenge remains in implementation of the policy or the actions into translating those policy into actionable items. We've also talked about availability of data. Again, yes, I agree to some extent. The challenge, I think, is there is less of an integrated data management and utilization mechanisms that is not available, as David rightly pointed out, that there are systems, but they don't speak to each other. I'll just give you one example from our own work experience. So I am head of governance portfolio at UNDP, and one of the projects is working on human rights, strengthening the ecosystem of data collection around human rights indicators in Pakistan. Help the government in developing a policy framework, but then we also supported the government in developing a HRIMS, human rights information management system. But turned out that if we have it at the ministry, if we house it at the Ministry of Human Rights at the federal level, there was no feeding mechanism or digitized or reliable feeding mechanism available in the provinces' line departments, which can feed into this. So now we are working with all the 4 provinces, and we have established this digital data collection mechanisms there. So the idea is to have this reliable data across indicators. Of course, Pakistan is signatory to a lot of human rights treaties and protocols. So now the shift is from having this Word document based data generation and dissemination to an integrated digital data generation and reporting. So that will kind of integrate this whole system of human rights management. Also, performance agreements were mentioned here. Of course, Dr. Saab's stellar work in his capacity as chairman of the Task Force on Civil Services. Performance agreements, of course, that is one step. Then we're taking it with support of FCDU, and of course, SAPM on establishment is taking the lead. The next step is to tracing and tracking the progress against these indicators that were developed in the performance agreements. And then, of course, also measuring and evaluating the complete the loop. So these are a couple of things that we are doing. Of course, another thing that I think needs to be done is simplifying the procedures. Government has policies, and then they have systems and mechanisms, but then there are layers and layers of it. So we are again working with the Federal Planning Ministry to simplify some of the procedures around the development planning and things like that. So I will just stop here. These were just some random thoughts, totally off from my agenda of presenting the report. I think you can talk about it. Thank you very much.
Thank you, sir. Thank you. Appreciate it, Mr. Rana Kesrisar. Now, I understand that I have to go back to the chair, and I'm also being told that I'm already 15 minutes past, and I may start losing online audience. But really, in the interest of inclusivity, and I see a lot of brain power here, and given that both Rana Kesris Saab and Naveed Aziz Saab have mentioned planning systems and PC1s and their collaboration with the planning ministry. So I see a strong representation of the planning ministry. So in case there are maybe one or two, sir, with your permission, if there are one or two interventions from the audience, so maybe we can take two, Dr. Idris Khwaja and Dr. Zubair Ghori. Mike de dijiye. Dr. Thank you, Doctor. Doctor, we can also collect from yourself, please. Thank you, Dr. Saab. Thank you very much. Now, I think because we want to continue this discussion over dinner as well, and we have to relieve the online audience too. So maybe in case the colleagues from SDPI, UNDP or FCDO would like to respond, maybe we can continue this discussion over dinner, but I really want to give it back to Dr. Saab now for his closing remarks. Is that okay, Najib sir?
Dr. Saab, after this question, I think I would also like to avail the freedom of being relieved. Not just online, but people who are in person. Just on a lighter note.
Thank you, Waqar. I'll be brief because we are past our assigned time. Let me focus on your initiative of the Center of Evidence, because Maria said that it's still in a formative and conceptual state. See, one of the difficulties, and I will partially answer the two questions which have been raised. One of the difficulties I faced while in the government is that the requirements of the government, both in terms of the timeliness, on terms of the simplicity of the language, and the relevance of research, are something which they find it very difficult to get off-the-shelf research from the researchers. So what this center can do is to become an intermediary between, like yours, simplify this in a language which could be understood and comprehended by the policymakers in terms of the briefs which are prepared very, very timely, because time of its essence. You have meetings with the Prime Minister and says, oh, I want this by Wednesday. Now you can't go to the university and say कि मुझे Wednesday तक कर दो, कोई नहीं करके देगा, तुम भी नहीं करके दोगे तुम्हारे researchers. But here you should be able to have an inventory of what the different policy requirements are, or you can start polling them and try to figure it out. I think SDPI has a fairly good idea because of your connection with the government. So you are actually intermediary, but don't build everything in-house. There is a huge reservoir of researchers. Bring them in a network. You have NAS, you have ComSets, you have PIDE, you have Qaid-e-Azam University, you have Fatima Jannah University, IIU. You know, I can name even Islamabad, but they don't even meet together. When I was the chairman of the Social Sciences Council of the HEC, I wanted to have a network of all the social scientists working here. But there was a lot of difficulty. Now your center can become, because you're not in the government, you're not HEC, you can try to identify who is expert in this particular field, who is in Sakkar, who is in Quetta, who is in Peshawar. In today's world, you know, online, virtual, webinars, you have a lot of tools which didn't exist before. So don't build the capacity in-house. Act as a network from where you can tap the resources and it will answer your question. And also, that will be the most useful way of serving that particular point. So it is your question is, what is to put it in a form which is very much comprehensible to the policymakers, because you have to publish your papers in HEC refereed journals, otherwise you won't get promotion. And that's true for you, sir. I have had the opportunity of heading IBA Karachi. My professors would say कि भाई मैंने तो अपने papers publish करने हैं, मैं अगर इस काम में लग जाऊंगा तो मुझे तो promotion ही नहीं होगी. So you look from their perspective, but at least this center can distill the information from the various sources, or single source भी नहीं होगा. And that I think is what I would suggest, Waqar and Dr. Faria, that you should try to bring in. I was associated with several think tanks when I was in the World Bank. And one of the very successful model was of the Overseas Development Council, where they will commission a group of researchers on a particular theme and put it in a language which is not only peer reviewed, because you guys have to make sure that everything is peer reviewed. So you have a lot of jargon. They simplify this in a way where the media can understand and also the policymakers can understand. That is your translation and intermediary work. So I hope that you do not go and build up a huge empire, which we tend to do, and that everything should be done in-house. Today's world is networks, alliances, collaboration. That is what you should continue to adhere to. You will never have in-house capacity. The capacity is distributed across Pakistan, and you'll be surprised, as I am surprised, as how much you can benefit from that. That is my suggestion to you. As far as the data and evidence, I think you made a very persuasive point. See, even the quality of data in Pakistan, I've been a user and I've been a generator of data. And I don't want to brag. Look at the data produced by the State Bank of Pakistan. Its timeliness, it is quality, its relevance, and its robustness. And look at the data which comes from the PBS. These national accounts of this country are based on 2005, 2006 surveys, which were carried out long time before that. The CMI, which we use for index of manufacturing, quantum index of manufacturing, is based on 2005-06. It shows, and I told this to the Prime Minister, I said it shows in the textiles, which has a weight of 20%, cotton, cloth, and yarn. In 2021, if you look at the exports of the textiles, 80% are value added and 20% are yarn and cloth, which are on a declining curve. But our quantum index of manufacturing shows us that textiles are going down. The quality of data is something which is required. So your task, along with the partners you develop, but at least look at the data entry, data collection, data verification, data validation, as whether they have the standards which you can meet them and you can certify. So you can actually fill in the gaps as far as the quality of the data is concerned. Because if you take this kind of data, I cannot make head and tail out of it. I cannot say that, you know, large scale manufacturing is receding, while when I look at the 2015-16 data of the CMI, the Punjab industrial sector has expanded 3 to 4 times. There are new industries, there are new capacity, there are new activities which are coming in the large scale manufacturing. But we are using what was in 2005-06. Now, how can you have an evidence-based policy making if this is the state of the art of your data? So I think you have to, I'm sorry to say that you do not want the data, but I think you have to concentrate and you have to provide assistance to PBS in order to improve the quality of the data. And final words, because we are already very much late on the is that ideas coming from foreign countries, foreign institutions are not alien. We seem to consider that everything done in Pakistan is what we should be looking. This is an insular attitude. Today you have a globalized world and knowledge is produced, generated, disseminated from various sources. It's not only the United States, it's also India, it's also China, which are producing. So you should have linkages both with the institutions like these centers, but also with the other institutions which can actually help you acquire new knowledge and new techniques of doing things. So don't be closed, but have an open mind and open doors. पाकिस्तान में हो गया है कि हर चीज फॉरेन जो है वो खराब है और हम जो है वो पीछे की तरफ चलते हैं. 2 bits for your consumption. Thank you very much.
Thank you, sir. And I think this advice and guidance will set some very strong bases for this Center for Evidence Action Research under the leadership of Dr. Faria, of course. So thank you for giving us these inputs, your time, and really appreciate these thoughts. I would like to close by thanking all our distinguished panelists, starting from Ms. Maha Rahman, Ms. Amna Akil, Mr. Naveed Aziz, Mr. Rana Kester Ishaq, Dr. Asim Ijaz Khwaja, Mr. Maruf Sayyed, and I think, of course, our chair for today's session, Dr. Ishrat Hussain. And let me also, of course, acknowledge and thank the colleagues, the esteemed audience, which have really joined us today in these late evening hours. We are really grateful for your presence and participation. We look forward to continued engagement as this Center of Evidence Action Research expands its activities. I think we can now move for dinner downstairs, and our colleagues and team would guide you. So thank you very much once again. Thank you.
Thank you so much.